Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on hypersensitivity reactions and vaccination principles, with 4 answer choices and explanations. Immunology, clinical vignettes, hypersensitivity and vaccination. 1. Type 1 hypersensitivity, anaphylaxis. A 25-year-old woman with a history of severe peanut allergy accidentally ingests a peanut-containing snack. Within minutes, she develops wheezing, urticaria, and hypotension. What is the underlying immune mechanism? A. Immune complex deposition. B. IgG-mediated cytotoxicity. C. T-cell activation. D. IgE-mediated mast cell degranulation. Answer D. IgE-mediated mast cell degranulation. Explanation. Type 1 hypersensitivity is mediated by IgE, leading to mast cell degranulation and histamine release. This causes anaphylaxis, urticaria, and bronchoconstriction. Type 2 hypersensitivity, hemolytic disease of the newborn. A pregnant woman is found to have Rh-negative blood. Her fetus is Rh positive, and she was not given Rh immunoglobulin, or HIG, in a previous pregnancy. What is the immune mechanism of fetal hemolysis? A. IgE-mediated mast cell degranulation. B. Complement activation via IgM. C. Antibody-mediated cytotoxicity. D. T-cell-mediated apoptosis. Answer C. Antibody-mediated cytotoxicity. Explanation. Type 2 hypersensitivity occurs when IgG antibodies target red blood cells, RBCs, leading to hemolysis. In Rh disease, maternal anti-Rh IgG crosses the placenta, causing fetal RBC destruction. HAR3 type 3 hypersensitivity, serum sickness. A 35-year-old man receives rituximab, a monoclonal antibody for treatment of lymphoma. 7 days later, he develops fever, joint pain, and urticarial rash. What immune mechanism is involved? A. T-cell-mediated apoptosis. B. Ig-mediated histamine release. C. Immune complex deposition. D. Complement deficiency. Answer C. Immune complex deposition. Explanation. Type 3 hypersensitivity involves immune complexes IgG antigen depositing in tissues, leading to inflammation, e.g. serum sickness, lupus, post-streptococcal glomerulonephritis. Type 4 hypersensitivity, contact dermatitis. A 40-year-old woman develops an itchy erythematous rash on her hands 2 days after wearing a new nickel-containing ring. What is the immune mechanism? A. IgE cross-linking. B. Complement activation. C. T-cell-mediated delayed response. D. Immune complex deposition. Answer: T-cell-mediated delayed response. Explanation: Type 4 hypersensitivity, delayed type hypersensitivity, DTH, is T-cell-mediated and occurs 24 to 48 hours after exposure, e.g. contact dermatitis, tuberculin skin test, poison ivy. SHA-5 vaccination, live versus inactivated. A 32-year-old man is traveling to Africa and receives a yellow fever vaccine. What type of vaccine is this? A. Live attenuated. B. Inactivated. C. Toxoid. D. Subunit. Answer: A. Live attenuated. Explanation: Live attenuated vaccines contain weakened pathogens that induce a strong, long-lasting immune response, e.g. MMR, varicella, yellow fever. Inactivated vaccines, e.g. influenza, hepatitis A, are weaker but safer. HAR6, vaccine adjuvants, immune boosters. A 65-year-old woman receives the pneumococcal conjugate vaccine, PCV13, which contains polysaccharides conjugated to a protein carrier. What is the purpose of conjugation? A. Activates innate immunity. B. Induces T-cell help for B cells. C. Stimulates complement activation. D. Prevents type 4 hypersensitivity reactions. Answer B. Induces T-cell help for B cells. Explanation: Conjugate vaccines improve T-cell dependent B cell activation, leading to a stronger and longer-lasting antibody response, e.g. PCV13 Hib vaccine. Vaccine-induced immunity. Herd protection. A 6-month-old infant is too young to receive the MMR vaccine, yet remains protected from measles in the community. What concept explains this? A. Natural passive immunity. B. Herd immunity. C. Complement activation. D. Innate immunity. Explanation: Herd immunity occurs when a critical mass of vaccinated individuals prevents disease spread, indirectly protecting unvaccinated individuals. 8. Passive versus active immunity. A newborn receives maternal IgA antibodies via breast milk, which protect against respiratory infections. What type of immunity is this? A. Active, long-term immunity. B. Passive, short-term immunity. C. T-cell-mediated immunity. D. Innate immune response. Answer B. Passive short-term immunity. Explanation: passive immunity provides immediate but temporary protection, e.g. maternal antibodies IVIG. Active immunity, vaccination infection, is long-term. Hazard 9, vaccine-induced hypersensitivity reaction. A 15-year-old boy develops hives and wheezing within minutes of receiving the influenza vaccine. Which vaccine component is most likely responsible? A. Aluminum adjuvant. B. Egg protein. C. Preservatives. D. Attenuated virus. Answer: egg protein. Explanation: egg proteins in vaccines, e.g. influenza, yellow fever, can trigger type 1 hypersensitivity, IgE-mediated allergic reactions in some patients. 10. BCG vaccine T-cell activation. A 23-year-old woman from India has a positive tuberculin skin test PPD, but no active tuberculosis TB symptoms. What explains this result? A. BCG vaccination-induced memory T-cells. B. Passive immunity from maternal antibodies. C. Innate immune response. D. Type 1 hypersensitivity. Answer A. BCG vaccination-induced memory T-cells. Explanation: the Bacillus calmette-guerin BCG vaccine for TB induces a T-cell response that can lead to a false positive PPD test. Key takeaways for hypersensitivity and vaccination: Type 1 immediate IgE, anaphylaxis, urticaria, asthma. Type 2 cytotoxic IgGM, hemolytic anemia, Rh disease. Type 3 immune complex, serum sickness, lupus, post-strep GN. Type 4 delayed T-cell-mediated contact dermatitis, TB skin test. Live attenuated vaccines, e.g. MMR, yellow fever, induce strong immunity. Inactivated vaccines, e.g. influenza, rabies, require boosters. Conjugate vaccines, e.g. PCV13, Hib, enhance T-cell responses. Herd immunity protects unvaccinated individuals. BCG vaccination can cause a false positive PPD test. Would you like vignettes on transplant rejection and immunosuppressive drugs next?